One-joint arthritis. Monoarthritis, or monoarticular arthritis, is the inflammation of a single joint. It is characterized by pain, swelling, warmth, and reduced range of motion. It is a diagnostic challenge, often caused by crystal-induced diseases like gout, pseudogout, infections like septic arthritis, or trauma. Urgent medical evaluation is necessary to rule out infections, which can cause permanent joint damage. Causes of monoarthritis. Following are the common causes of monoarthritis: osteoarthritis, septic arthritis, Pott's disease, gouty arthritis, pseudogout, psoriatic arthritis, reactive arthritis. Let's discuss them one by one. Osteoarthritis. Osteoarthritis is a chronic, degenerative joint disease, characterized by the progressive breakdown of articular cartilage and changes to the underlying bone. It is on and off pain of weight-bearing joints. It occurs when the protective shock-absorbing cartilage lining the joint thins and wears away over time, ultimately causing bone to rub directly against bone. Septic arthritis. Septic arthritis is a painful, destructive infection of a joint by bacteria, fungi, or other microorganisms. It occurs when microbes enter the joint space, triggering severe inflammation. The classic clinical presentation of septic arthritis features a hallmark triad of symptoms: fever, severe joint pain, and impaired range of motion. Pott's disease. Pott's disease is a serious extrapulmonary bacterial infection, where Mycobacterium tuberculosis spreads from the lungs to the spine. It is also known as spinal tuberculosis. It degrades the vertebrae, frequently causing chronic back pain, spinal instability, bone collapse, and permanent deformities if left untreated. Gouty arthritis. Gouty arthritis is a form of inflammatory arthritis caused by the accumulation of uric acid crystals in a joint. It develops secondary to chronic hyperuricemia, where serum urate levels exceed the physiological saturation threshold of 6.8 mg per deciliters. Pseudogout. Pseudogout is a type of arthritis that causes sudden, painful swelling in a joint. Pseudogout is caused by calcium crystals, usually hitting the knee or wrist. It is also known as calcium pyrophosphate deposition disease. It gets its name because its intense flare-ups look exactly like regular gout, but it is caused by a completely different type of crystal. Psoriatic arthritis. Psoriatic arthritis is a chronic autoimmune inflammatory disease that affects the joints. It generally develops in individuals who already have psoriasis, which is a skin condition causing itchy, scaly patches. There is no cure, but early treatment can manage symptoms and prevent joint damage. Reactive arthritis. Reactive arthritis is a type of joint pain and swelling triggered by an infection in another part of your body, most commonly your intestines, genitals, or urinary tract. It is an autoimmune response, meaning your immune system mistakenly attacks your joints after fighting off a bacterial infection. It typically resolves within 6 to 12 months, and treatments focus on anti-inflammatory medications and addressing the underlying bacterial trigger.